We'll go to the next presentation by CLARISSA Su, Assistant Investigator with Kaiser Permanente, Washington Health Research Institute. And CLARISSA will present on the immunity community, a community engagement strategy to boost vaccine confidence. Over to you, CLARISSA.
Thank you so much. I'm really excited to be here today to talk about the immunity community and our evaluation results. Excuse me. The immunity community was created through a public-private partnership. It's called Vax Northwest. And here there are some of the logos from the founding organizations of Vax Northwest. And I just want to point out, at the time that immunity community was taking place, I belonged to Group Health as part of their research institute, and now we're Kaiser Permanente, Washington. The program was implemented by Within Reach, which is a Seattle-based nonprofit that connects parents in Washington State with needed health resources. And I was the primary investigator for the evaluation, and I currently sit on the board of Vax Northwest. And I also want to point out that Vax Northwest takes no pharmaceutical dollars. So a little bit of background about the program. Vax Northwest and the Immunity Community Program were formed when it was noted that there was growing alarm around the rate of vaccine hesitancy in Washington State. These maps illustrate the kindergarten exemption rates as they changed over a decade, and you see that there are pockets where we have very high kindergarten exemption rates. In 2011, there was some improvement. Around 2012, a new policy was passed at the state level around exemptions, kind of as Dr. Mello was talking about, but it was not as robust as California's, and our overall exemption rate dropped to 4.6%, and it stayed pretty much there. But even with that improvement, Washington State still has one of the highest school-age exemption rates in the United States. All right, so the immunity community was created to address this growing concern about vaccine hesitancy. And the hope was, well, I should say, there was some research done by Vax Northwest early on, a literature review, and some parent focus groups, and they realized, one, that the majority of parents do vaccinate, and they're a silent majority. We don't hear from them as much. So that was one key thing. And the other thing was that if you talk to vaccinating parents about herd immunity and the problem of vaccine hesitancy, they were easily activated. So the idea was to create a program that got parents to work with organizations. It turned out schools and daycares were one of the kind of key, easily targeted organizations to spread positive messages about vaccination. So the immunity community was created, and it was created with the help of VCDC Ideas, which is a marketing firm that specializes in social marketing campaigns for nonprofits. And also we had a community advisory board that helped develop this. And I wanted to show a few images from the immunity community materials. This is the Parent Action Guide. This was used to train the parent advocates, and it includes information about vaccines, guidance about having difficult conversations using some of those same principles we've heard talked about in terms of like aims and motivational interviewing. Had ideas for doing community advocacy and updated information resources. I want to also share, this is just an example of some viral images that were created for parent advocates to share on social media. And this just gives a good example of all the different kinds of images that were created. On the left, you'll see what were called the real parent line of images and materials. And those were developed after the first year, where we got feedback in parent focus groups that they wanted to see real parents like them and what they had to say. So there are videos and a whole line of materials created around this real parents line. All right, so jumping into the evaluation findings, we did our evaluation based on a logic model approach, and we had a very robust evaluation with a number of different data collection activities. They include observation and document review. We had the parent advocates track their activity monthly and send in monthly reports. We did media tracking. We had a pre-post cross-sectional parent survey that looked at knowledge and attitudes. We did key informant interviews yearly with the parent advocates, with representatives from the organizations, basically the schools that they were part of, and with other stakeholders. And then we did yearly focus groups with parents at the organizations that were involved. So one of the first kind of outputs we had from our logic model is that we actually successfully, that they actually successfully implemented the program and were able to expand it. This infographic shows that from year 1, we had 4 sites and 6 parent advocates. And by year 2, they had 10 sites and 14 parent advocates. And the rest of the infographic I won't go into, but shows the increasing training and technical assistance that was provided. All right, so another key outcome that we wanted to see was that parents actually took action to raise awareness. And there are 3 areas where we saw that this happened. One is that parents helped sites monitor their vaccination rates. So in Washington State, elementary schools, daycares, preschools are required to collect immunization information on the children participating in their programs, but there's very little resource for accountability and monitoring of that, whether they do that. So what the advocates did was often come in and kind of hold their organizations accountable, and also provided tools for them to collect data and look at whether they had up-to-date records, and sometimes they even actively helped them collect the records. Another thing parent advocates did was educate parents. So they did that through a variety of mechanisms. They had Q&As with local physicians. They went to science fairs and had booths. They had one-on-one conversations. So there was a variety of things they did to educate other parents. And then a number of them were really active on social media and did a lot of work around generating conversation via social media. So I wanted to highlight one of our parent advocates. This is Alisson. She, at the time, was the mother of 3 young children ages 6 months to 6 years old. And here are pictures of her at 2 different community events that she had a booth at. And you see the community provided this wheel of vaccination, which had the kids would spin the wheel and they get questions about vaccines. And there's lots of swag associated with the campaign as well, the program. So that's one type of action they might take. There on the slide she had 17 conversations with other parents. She sent 11 emails about the community. She disseminated materials. There was a bunch of planning activities she took part in, and she posted 11 social media posts. And this is during her year of participation in the community. So we had I talked about the pre-post cross-sectional survey. And so one of the things we looked at it on that survey, I didn't include all of the results here, but one area was looking at parental attitudes about vaccines. And we had several significant changes in the directions that we wanted them changed. So the orange highlights are positive, the changes that were significant. So, and for example, I'm more concerned about other parents not vaccinating their children. We saw a trend upward, so that more parents agreed with that. And then fewer parents endorsed the statements like vaccines are given to children when they are too young, and individual people are responsible for choosing whether or not to vaccinate. And there at the bottom, more people said they were confident that vaccinating your child is a good decision. And then overall, we saw a decrease in hesitancy from cohort, the first cohort to the second cohort. And you'll see, as we've talked about, that the very hesitant group did not move much at all, but we see a big jump in the somewhat hesitant group, which is to be expected because they're more influenceable. Another goal was to get messages out in the community at large, and here are 2 examples. One was the one on the left is a Time magazine article that highlighted the immunity community and one of the parent advocates. And the other on the right there, we see a local Sunday newspaper with the immunity community highlighted on the front page of the Sunday edition. So I always like to see policy change, and that indeed was one of the goals of the immunity community. We were thinking about more organizational level policy changes, and we did see some of that in terms of collecting immunization information. And we had one really big success, which was within reach, and 2 of the parent advocates worked with the Organization for Parent Education Programs, which is the organization that oversees all of the cooperative preschools in Washington State. And they helped them to adopt changes to their risk management manual, which included new information about immunization and importance of immunization, They also set up guidelines for collecting immunization data and required the co-ops to appoint 1 to 2 people who were in charge of collecting immunization data. And they also gave guidance around what to do in case of a disease outbreak. So this was a huge win, and the potential to impact 10,000 families in Washington State a year. All right, so just a few lessons learned I wanted to highlight. The one key success factor was that organizational leadership support at the organization level, that's the school level in this case, was really important because there were a few schools where actually the teachers were resistant to these messages, and so that proved really challenging for the parent advocates who had to go up against teachers who were actively resisting these messages. So that was kind of a critical kind of factor. All of the parent advocates talked about the importance of strong technical assistance and support. We had great program staff who were very responsive and were able to get them resources in a very timely manner when they came up against a question or had concerns. And then the other thing was having a site where there was a culture of active engagement already was really important. So for example, if the school already had a forum, like an online forum where parents were engaging already, the parent advocates could use that to spread messages. Or if they had actually a physical space like a lobby where they tended to see each other. There was one daycare where I think the kids were brought out and put directly into cars, so there was no space for them to have those kind of conversations or leave materials or engage other parents, and so that could be challenging. And then finally, I wanted to highlight the couple of challenges. Mainly, I'm going to talk about the recruitment piece. And I think this was like the largest challenge in that recruitment takes way more time than ever anticipated because it involves going into a community, building trust with the community broadly, building trust with these schools, daycares, and other organizations like the health department and the school districts. And then from that, recruiting the organizations and then recruiting individual parents. So when we drew out a timeline of where time was spent, there was a large amount of time spent on the recruitment piece that was not, I don't think people anticipated, or it's not obvious when you look at this program that that's really where a huge amount of resource needs to go. The implementation challenges I'm not going to talk about, they're pretty much the reverse of the success factors. And then also there's the issue of replication and sustainability. We've heard this talked about a little bit. Sustaining these types of programs can be really challenging. There aren't a lot of resources to fund these types of programs. And like I said, we tried to do some lower resource models, and the recruitment actually phase was really where they fell down. So another thing, I didn't put a reference to our paper, but I'll put that in the Q&A box. We do have a paper that summarizes our findings and is more complete than what I was able to present today. So I want to wrap up by acknowledging the parent advocates, the site representatives, and Vax Northwest, and also Mackenzie Melton, who was the project coordinator at the time, and the Group Health Foundation funded our evaluation. So thank you, and I will stop sharing and come back on when we have Q&A.
Thank you, Clarissa, for a very interesting and practical example. Great to see how all these frameworks actually take real life in engagement of parents and communities. So I'm sure there will be lots of questions about this.